work at Montclair Medical Center, Mountainside Hospital, and I'm an exercise physiologist there. I work in the cardiac rehab unit. Just to give you a little overview of what I do there, we work with patients that have had open heart surgeries or heart attacks or different heart procedures or a heart history, and we help them exercise on different equipment, monitor to make sure everything is going good, that their heart is benefiting from exercise, and if not, then we communicate with their doctor just to keep communication open and monitor them to make sure that they're getting the best out of the exercise. So today we're just going to discuss the benefits of exercise, the components of physical fitness, and how to start a program if you're not already on a program, how to be safe when you're exercising, and then we'll do a little demo and give you some ideas of what to do when you're at your desk if you're not able to go to the gym, or just when you're here throughout your day for a long period of time and not moving. We'll give you some little things that you could do. So before we start the demo, we'll just talk about moving for a healthy heart and more. So if in your folders, if you want to follow along, you do have a handout in there too. So we'll just talk about the type of exercises. The two main ones that we really concentrate on is aerobic exercise and then strength training, or also known as anaerobic exercise. So if anyone has any trouble hearing me throughout the presentation, just let me know. Or if you have any questions, it's okay to interrupt and let me know what your question is. So with aerobic exercise, that's what stimulates your heart rate, breathing rate, and it increases it. And it's something that you sustain for a decent amount of time, like 10 minutes or more. So for example, it's like walking, bicycling, dancing, swimming, something that you're doing a repetitive movement. For strength training, like I said, anaerobic, also known as, it's a type of physical exercise specializing in the use of resistance to induce muscular contraction, which builds the strength, endurance of an anaerobic, and the size of skeletal muscles. So it could be something added like weights or a machine that you use, a weight machine, or it can be your own body weight, which is better known as calisthenics. For example, like a push-up using your own body weight. So we go to the different components of physical fitness. And for the best routine, you should incorporate all of these components. So cardiovascular endurance. So that's like when your breathing is controlled while you're exercising. I don't know if anybody ever experienced where you're doing very strenuous work and you feel like you're breathing really heavy and you have to either stop or slow down what you're doing. That's your cardiovascular endurance is lower, or just you're doing something that's very strenuous for you, and then that your body's telling you that you should slow down a little bit. Then you have muscular endurance. So like if you're a runner and you like to run long distances, or for me, long distances is a 5K, so not to someone else. But that just shows how if you're able to hold that up and your legs are okay, they're not really painful after you're done, you have muscular endurance. Then you have muscular strength. So that's more so focusing on lifting something heavy, or when you're doing like a squat, when you're bending your knees and coming up and you're able to do more than one with added resistance, like weights. So flexibility, like one is touching your toes or being able to sit a certain way, like with your legs cross. Not everybody can do that because they're not as flexible. And then you have body composition, like measuring your body fat percentage, or BMI, which is how you compare your height and your weight. That's a way to know how, if you're obese or if you're at the ideal healthy weight with your BMI. Then you have balance, which is an issue when you get up there in age. At the cardiac rehab at the hospital, a lot of our older patients, we have people up to 95, and you start to see problems with their balance, because that's something that we normally don't focus on. And they start to walk with very short steps instead of like heel toe and walking bigger steps. And when they shuffle, a lot of times that they can catch their foot either just on the floor or when they're walking on the curb, and a lot of times that's where falls come from. That's why it's important to focus on balance. And agility is another one to focus on. So when you're walking, that you're able to change your direction very quickly, and that can help prevent falls. So then we I break down the different benefits of exercise in different systems of the body. So we look at the cardiorespiratory system, so like your breathing and your ability to get the blood circulating and get oxygen to the blood or the muscles that are being exercised. So we look at what it decreases heart rate, and it decreases your resting blood pressure if you're exercising on a regular basis. And it improves the breathing capacity. So like I mentioned before, if you're exercising, doing something very strenuous, you're labored breathing, it's hard to catch your breath, it's hard for you to talk. And that shows that you have to work on the breathing capacity. Then you look into your metabolism. It improves the blood glucose regulation. So your cell sensitivity to insulin is improved. It increases HDL, which is known as the good cholesterol, and it carries cholesterol to the liver where it's broken down. So if you have problems with your cholesterol, if you have high cholesterol, if your HDL is high, then that gives you a better chance of preventing your cholesterol levels causing a problem with your health. And then it promotes fat loss. And then we look at resistance training, how that's beneficial. It helps increase muscles, decrease fat. And I just want to point on, a lot of times people say, oh, I've been exercising for 2 months now, and I only lost 1 pound, or I gained 2 pounds. Why is that happening? Well, we tend to, when we're exercising, doing something that builds muscle weighs more than fat. So your weight may stay the same or increase in the beginning because you're building the muscle and decreasing the fat. So every time you look at the scale or you step on the scale, it's not always the important part of if you lost weight. It's a lot of how you feel to know that if you're improving with your exercise. And then it strengthens and tones different parts of the body, so like your abs, your lower back, hips, and it strengthens the ligaments and tendons and bones, which is really important to prevent injury. Because if your ligaments are nice and strong, if you are very active or if you're not active too, like if you sprain an ankle or have a problem with your knee, if your ligaments are strong and they can hold in, then it helps prevent from the injury. And also increase the bone density, which when we get older, our bone density starts to decrease. So exercise helps to increase it with weight-bearing exercises. Then we look at stretching, how that's important because it helps, again, to prevent injuries. So if you're able to reach to the floor and pick up something without your back cracking, or it's pulling something in your back, that's really beneficial for you to prevent back pain. And it promotes circulation too if you're flexible. And balance, as we talked about, reduces fall risk and improves activities of daily living. So just basically being able to walk, get out of bed, get out of a chair becomes hard if you're not active and moving around. Anybody has any questions yet? Okay. So we just have some guidelines here when you start to exercise. The most important thing is always check with your physician and make sure that you are cleared to exercise. Make sure they feel like it's something that you can benefit from. Your attire should be something comfortable that you can move around in and you don't feel restricted. You want to keep track of your pulse is one way to know that you're exercising at your best benefit. So you can take your pulse. There's a little picture inside where you would line up with your thumb and around your wrist. You would feel how your pulse is doing a little thump against your fingers. And we recommend that you count for 10 seconds. If you have like a second hand on a watch, or you're in front of a clock. And then whatever number you get, you would times that by 6 to get a whole minute. And that's done only 10 seconds, because when you're exercising, your heart rate goes down very quickly. So we only do 10 seconds of stopping and checking it to make sure that your heart rate doesn't drop too quickly. And you don't want to be too high above what your resting was. A lot of times when you're exercising and you haven't done it in a long time, your heart rate might shoot up. But once you're nice and comfortable with the exercise, then it won't shoot up more than about 40 beats from your resting heart rate. That's why it's important to know what your resting heart rate is and then what your exercise heart rate is. You can do it there, but we don't normally recommend it, only because you don't want to cut off any circulation that may, like if you're really moving and everything is flowing quickly, and if you're pressing too hard, you don't want to cut off any circulation to the brain. So that's why we recommend it here on the arm. Sometimes people can't feel it on their wrist, and they like to do it there, but normally I just like to do it on the wrist. And some reasons to stop exercising: if you have any chest pain, if you feel fatigue, like I was saying, the labored breathing and shortness of breath, or if you just can't go on anymore. Your body definitely tells you if you can or cannot. So it's really important to listen to your body. A lot of times we feel like, oh, we can push through it. And I know it used to be no pain, no gain, but I don't recommend no pain, no gain. Your body lets you know if you need to slow down or stop. And if you feel dizzy or nauseous, or if you hurt yourself due to an injury. If you tend to exercise on your own, it would be a good idea to bring a cell phone with you, just in case there's ever something that occurs where you need to call somebody for help. Be it the emergency or somebody at home to come and help and get you. So it's recommended that you do a warm-up of exercise. So that's like stretching, and then if you're in the park, walking around the park just to get your blood going before you start to exercise. And then 30 to 60 minutes of aerobic activity is recommended, at least 3 times a week. 3 to 4 times a week is minimal. And one way to know that you're exercising the most beneficial is when you're taking your pulse. We were saying that the resting, and then also a talk test. So if you don't have time to check your pulse, a talk test is if you're with somebody, or you can be alone. If you're able to sing a song or you have a small conversation with someone, then that shows that you're okay to continue to exercise. If you're labored breathing and you can't hold a conversation, that means that you should slow down or stop the exercise. If you're holding a really long conversation, telling somebody what you did, your life story, then maybe you should increase what you're doing and exercise a little harder. And then after the exercise portion, you can break it up. It doesn't have to be exactly, let's say, walking for the whole time. You could do walking around the track for 20, 30 minutes. And then if you're at a park where they have hills to go up, you can do that for a couple of times too. So you can change what you do. You don't want to get used to the exact same thing all the time. Or like I mentioned, doing something that you enjoy. Like dancing. If you like dancing, that's a really good exercise. You could do like a martial arts. You could do swimming. It's also something that's fun for people. And then that cool down is very similar to what you would do for warm up. So cool down is just very slow. So you want to bring your heart rate down. You want to do some stretches. You want to just calm down your heart rate and blood pressure. And then stretching to prevent any injuries. So if you don't have any questions, we can actually start with going to the exercise for that. So it's the desk exercises where they have all the pictures here. So with strength training, just to touch on that quickly, definitely doing something that you enjoy doing. Like I said, it could be either adding weights to the routine, maybe at a gym if you have access to it. If you don't, you can even do stuff at home. You can use like cans of soup for exercise. You can do, sometimes I do my kids, like picking them up and doing squats with them. So just don't drop them. That's all I'm going to say. But yeah, so you can use different things. And like I said, body weight for with the weight training, with the strength training. With the tips of exercising while you're at work. Movement is very important. So even if you're exercising, let's say 3 times a week, you go to the gym, 3 or 4 times a week, you go to the gym for 60 minutes, and then you come into work and you sit for 6 to 8 hours not moving at a desk, you still would be considered sedentary because you're sitting still for that long period of time. We're animals that are supposed to move throughout the day because we used to be hunters and gatherers. So we are supposed to be moving around. So one tip that's really important that you may be able to do is set a timer every 45 minutes just to give yourself an idea, oh yeah, I do have to move. A lot of times we're focused on work. We forget, like, time passes and we are sitting still for 3-4 hours not moving whatsoever. So that would be a good idea to just set a timer and get like moving around your desk, or if you could walk the hallways, that would be something good to do. So the stretches that we're going to do today, if anything hurts, don't do it. That's really important to know. And maybe using the stairs would be another tip to do. Take a break for like 5 minutes or so and walk up and down the stairs just to get your blood flowing. Like on your lunch break, if you could take a walk when it's nice outside. Pay attention to your posture while you're sitting at your desk is very important, because a lot of times if we're slunched over and we're not getting a lot of flow, like blood flow, when we're sitting over, we're going to kind of restrict everything when our posture's like rounded shoulders. So sitting up nice and straight with your head up and not like looking down, just to at least a break of it if you have to look down when you're in front of a computer. And I don't know if it's an option here, but like a standing desk would be another way to be able to move around. Or even when you're on the phone, at least walk around when you're on the phone and you don't have to be right in front of the keyboard is another way too. So I have a wonderful model that's going to demonstrate some of our exercises for us. And we'll just do an abbreviated demonstration today. So Megan, if you can come to the chair, please. Yes. So some of these routine some exercises can be done seated, and some can be done standing. So we can adjust it how we need to. So the first one we're going to do is called the cervical extension and sitting. You're going to just sit up nice and straight, and you can follow along, at least for the ones that you can sit for. And what you're going to do is put your finger on your chin, and make sure that your chin is leveled with your lap, so it's not like down or too high up. And you're just going to push back. So in a way, you can describe it as giving yourself double chins. And then you're just going to hold that for about 2 seconds, and then repeat that 10 times. So we'll do abbreviated, but we do have directions here on the handout to let you know. And you would repeat that throughout the day, because this is strengthening your neck. A lot of times you might get headaches, or your neck might bother you because you're, like I said, either looking down or looking up at the computer. Usually not too much, you're looking like level, and this helps to strengthen the back of your neck. So you can keep just one more time. Just hold it, and then release, and then hold, release. Let's try one more time. Hold it, and release. And it also can be done without the hand, but this just gives you a little extra push. So the next one is the Levator stretch. So what you're going to do is lift your right arm for me. Yeah, so lift it up, and then you're going to look toward your right underarm and tilt your head down. Now bring this over. Yeah. And so now you're going to just pull your head down. And then your other arm is going to go behind your back. So this way. So do you feel the stretch here? So this is, yeah, that's called the levator scapula. And that muscle a lot of times tightens up because of the way that our posture is. So that's a really good way to help stretch that out. So we can repeat to the other side. So the main thing you do, you look at your underarm. So like look underarm and then down. Then you bring your arm over. And then just give yourself a nice little pressure, but you don't want to pull down. It's a check. That's a good way to do it. So now we can just repeat on the other side. So we can, one more time on both sides. So just lift your arm up, look down, over, and then arm behind. Hold that about 5 seconds. Okay, repeat on the other side. So again, arm up, look down to armpit, bring your arm over. Okay, good. And I know that's probably like a really good stretch that we all need it. And then the next one, you're going to hold on to the bottom of the chair. So the way that you're going to do it is, so we'll start with our right hand. So hold the bottom of the chair. And what you're going to do is kind of turn toward me just a little bit, with just your head. Yeah, and then you're going to go, wait one second. So you're holding on the right, you're going to turn to the left a little and actually go to the left. So you're getting a good stretch throughout. So if you hold the bottom of the chair, that gives you a more stretch because you're going to keep your shoulder down. Because a lot of times we tend to raise our shoulder. Keep your shoulder down. And then you're going to look down a little and then over. So now we can repeat the other side. So if your arm is long, sometimes that happens to me, you can just bend your elbow and then you'll get more of a stretch on that side. So we can repeat on the other side. So the next one, we don't have a doorway nearby, but so what you would do is stand inside of the doorway in the threshold of it. Your arms will be on the side, either side of the door, and then you would just step through the doorway. So we're going to have an imaginary doorway here. Oh, and we can direct our attention to Flore. She's over there. So what you're going to do is step through. So one foot goes in front and then you, So that's a really good pec stretch for the chest. So it opens up. A lot of times we're sitting in front of the computer and we have our rounded shoulders. So that opens you up. So the doorway here, we step through, threshold, and then bend the knee, push through, and then you're getting a good stretch here.
So I had a pinch nerve before, and I didn't know it was a pinch nerve somewhere back in here. And these exercises that you're giving us is what the physical therapist gave me. I would really experience the pain when I'm sitting down typing. I thought it was like carpal tunnel because I would get the tingling in my hand and or if I was driving, a lot of numbness. And these exercises actually help with it.
Oh, good.
The doorway exercise and the last two exercises.
Like the neck. So that's wonderful. So if we can all prevent having a pinched nerve, that would be great. Thank you for sharing that. And then the next one, we're going to be in the back of a chair. So if you like to do it, you could stand for this one. Yeah, so you can stand back of the chair. So you can just hold on to it. So what we're going to do is hold on with one hand. We're going to start with the right. So the right one is going to go through, it's like through the hand. Here, I'm going to step out a little bit. So you'll be holding on to the chair. You're going to go through, and then you're going to come all the way up and look at your hand the whole time. And hold that. And then come back down. One more time on this side. And then come all the way up and look at your hand. And that's good for rotating your torso. Now we can try the other side. So again, holding on the chair, you're going to go through and then go all the way up, following your hand. And then come back down. One more time. And up, following the hand. Okay, so this is a really good one that you can do at your desk. Just stand behind your chair and you can just stretch out here, and also it's helpful for your lower back and torso. The next one is good for your upper back scapula area. So you're going to bend your arm, and you're going to bring the other arm by the elbow, and you're just going to bring it across you. And we're going to hold that for about 5 seconds. And these are all like things that you could do right in front of the computer, but you don't really think of doing that. But we all need movement. And then we're going to relax, and then you're going to go to the other side. And then pull it across. Yes. And then we can do one more time on both sides. So bring it in front of you and then across. And then the other side. Okay. So the next one, we're going to use our imagination again. So this is called a wall lift off. So if you had a wall right in front of you, or you can also do it without a wall like we're going to do, you just have your hands like 90 degrees right in front. Then you're going to go up and out to the side, and then you're going to bring it behind you as you can, like if you can go to your ears and back. And come back down. And then we're going to repeat. So 90 degrees, hold it there. We're going to go up and out and bring it back. So good 5 seconds. And relax. So these are all really good stretches. The next one is so good for strengthening. What we're going to do is we're going to hold on to the chair. I know these chairs move, but it should be okay. So you're just going to try to lift yourself up off the chair. You can keep your feet down. More advanced would be trying to lift completely without your feet touching, but you're just going to, you can do the handles too on the side. So, but if you're in another chair, you can just like Megan's doing, you can just lift up and hold it there. And then come back down. And then one more time. So if anybody has any problems with your wrist and it bothers you, then I would avoid this one. But this is a really good one to strengthen your arms and also to focus on your wrist too. So that one you would repeat 5 times, at least 2 times a day, just so you can really strengthen your arms and your wrists, especially because you're always typing and your wrist gets really tight. And the next one I probably would not do because of the chairs go up and down, but it's like a sit to stand. So basically you're just going to stand and sit. But make sure your feet are flat on the floor. And instead of trying to push yourself with your hands, or if you had any handles on the side, you would just use your legs to get yourself out of the chair. So, so you would lean and then sit back down, but don't. Yeah. But make sure the seat is behind you. There you go. So that one would be a good one to repeat. be careful if your chair has wheels, which probably most of you do. If you don't have one that like maybe like this that you can use, then I would do that at home for something that a chair that doesn't move. But it's really beneficial for your legs to strengthen them that way. So the next one is just a trunk rotation. So what you would do if you had handles on the side, you would just twist to the side, holding on to the handles. If not, you could just bring your hands together, holding, and then just pull to the side. So you're just twisting your trunk. And to the other side. So this is very helpful for your lower back, for just your spine in general, and going into your glutes too. So back to the other side. So that one's about 2 seconds to repeat, but if you want to get a good stretch, you can hold it at least 5 to 10 seconds. And then back over. So the next one is called seated Pryor stretch. That can be done at a table, or it can be done without one, actually. So you're sitting in a chair, and it's just like you're reaching in front of you. So almost like somebody is imaginary pulling your arms is what you want to experience. So you're sitting in a chair, and then you're going to go really reach. And then come up slowly. And then forward again. And then sitting up. So this is really good if you're sitting at your desk, you've been on either the phone or on the computer for 2, 3, 4 hours, and you're like, oh my goodness, my back hurts. So if you have a clear space, or if you just move away from your desk a little bit, you can hold on to it, and then you can just push back in the chair if you have wheels. That can definitely help with the lower back. And then the next one is called the Roman chair with the march. So it's just marching in the chair. So you lift one leg up and then switch legs. You could do it that way, or a little advance. You could do it with both legs up, actually. Here, let me put your hands on it. You don't have to. Let me see if I could try it. So you could just you're marching, and then you're going to lean back slightly. And you're marching, keeping your abs tight. Or you could do both up. And that's more advanced. Oh, darn. These two got it. But you definitely feel it in your abs. Yeah, so when you're working your abs, you're definitely helping to strengthen the back too. So that's a really good one for your core, a really good core exercise. But you can just do like the marching where one foot's down and the other foot's up. But if you feel like you're a little bit more advanced, it's okay to do both up. But I recommend if you're just starting out, doing one at a time. Then we have at your desk, really good with a rolling chair with your feet. So basically you would push away from your desk, and with your feet, you're just basically going to try to get yourself closer to your desk. So I know we don't have a rolling chair, so basically just put your foot out, and it's almost like you're pulling yourself toward your desk. And that's really good for your ankles and good for your calf and shin muscles in the front of your leg. So basically your feet are down, and then you're just pulling yourself toward the desk in the rolling chair, unless you're really strong in one of the sturdy chairs. And then we have what are wall squats. That's normally done against a wall. And I'll try to demonstrate it over here. So it's basically you're standing against a wall. You're going to step away from it a little bit with your feet, but your back is against the wall. And you're just going to come down and hold that for a few seconds. But I'll show you what it looks like. So this is my wall. And then your feet are a little further away, about a foot away. You're just going to come sit. You can sit for a couple seconds and come back up. If you feel like you can do a little bit more, then you can sit for about 5 seconds. So your legs are really getting a good workout there. And then slide back up. Yes? Well, depending on how far you can go down. I would recommend whatever's comfortable for you. I don't want you standing there for 2 seconds feeling like you're going to fall. So I'd rather you just go to the point that you feel comfortable but still feel like your legs are working and come back up. But you could also go further down if you feel like you could. That too. So we have the next one is called a single leg squat. It's normally done with a chair, but it also can be just a lunge, which is both feet are on the ground. So I'm going to demonstrate what they have here, but I recommend just to do a lunge. So you want to try it or? Okay. So I wouldn't recommend you doing this, especially with a chair that moves. But if you can put one foot up, the other foot, you're just going to hold that and come back up. Or you can do a lunge, which is both feet are down. Step a little further apart, and you lunge, you come, the back knee goes straight down. Straight down. So the back heel is up, and you do it back. That one I recommend more than you have to single squat. Thank you. And your last one, you can hold it for a few seconds now. Yeah, just to get, but I wouldn't hold it for too long. Sometimes people might get stuck there too. So, so the last one actually is going to be a seated hamstring stretch. It's really important to have your hamstrings flexible because that tends to affect your lower back. A lot of times if your hamstrings are tight, it affects your glutes and it also affects your lower back. So that's the back of your upper leg is your hamstrings. So this one can be done standing or sitting. I'll demonstrate it standing. So what you're going to do is have, so one foot is going to be in front of you. Your toes are going to be up and you can reach toward that. So you can also do it sitting. And you can really feel it in the back of your leg. And you don't have to touch your toe if you can't, because I'm not flexible either to touch it, but at least you're going to that direction. And you want, like all these different exercises, I know I said if anything hurts, don't do it. But if you're stretching and you do start to feel pain, I would ease up a little bit. Keep the stretch, but just don't do as deep because you don't want to feel pain when you're stretching. You do want to feel a little bit of a pull, but once you start feeling that pain, then that's when you want to back up a little. Okay, so that's our demonstration for the exercises. I hope they're helpful for you when you're at your desk because it's really important to get everything moving and circulating. Anybody has any questions? Okay. Well, thank you, everybody. If you don't have any questions, thank you.